Live from WKYC Studios, this is 3 News at 6 with Russ Mitchell and Christy Paul.
We don't want to see people use drugs, but we sure don't want to see them die either.
And good evening. Thanks for joining us. We begin tonight with the startling news of 9 overdose deaths in 24 hours in Cuyahoga County, a number that signals the opioid epidemic is not over.
In fact, tonight, the Cuyahoga County Medical Examiner says we have never seen a number this high, even in the worst year of 2017.
Our senior health correspondent, Monica Robbins, dives into the numbers.
9 people, 7 men, 2 women, aged 26 to 65, all dead from suspected overdose in the last 24 hours.
These are like records I would prefer to never see.
It's the highest number of overdoses in a 24-hour period the county has ever seen, likely linked to fentanyl and perhaps not what people were buying.
Cocaine and crack, they're dangerous drugs in their own right, but the individuals who are using those drugs are frequently, I think, getting surprised when fentanyl's mixed with it or fentanyl's just substituted for it.
The medical examiner issued a public health alert encouraging people to use test strips to test drugs for fentanyl before using. Never use drugs alone, and always carry naloxone in the event someone overdoses.
We don't want to see people use drugs, but we sure don't want to see them die either.
Naloxone is available for free at several Project Dawn sites, or you can buy it for as little as $20 at Giant Eagle pharmacies with a coupon from GoodRx.
You may be in for something you're really not expecting, and unfortunately, that may be the last, chance you get to, save your life.
Now, you can't give naloxone to yourself, which is why they're asking people to never use drugs alone. Also, those who call 911, remember Ohio has the Good Samaritan law that gives immunity for a minor drug possession for both the person who overdosed and the one who calls 911. Now, in a perfect world, all of these folks would seek treatment, but in the world we live in, offering harm reduction strategies may at least save some lives to help them eventually get into treatment, Russ.
Again, some frightening numbers there. Monica Robbins, thank you.